Whoa, 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 there we are in the place to be. Yeah, 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 yeah.
Good morning, everybody. It's Positive Tuesday today, January 12th, 2021. Everyone's having a wonderful day and a great weekend. For Barron County Sheriff Chris Fitzgerald, I'm Ben Dryden, and you're watching Positive Tuesday with Ben and Fitzy, presented by ICAA. ICAA is your local social service organization that works together with individuals, families, and the community to create and support local solutions for local needs. For a full list of services from ICAA, check them out on their Facebook page or visit the website at IndianHeadCAA.org. A quick programming note. This Thursday, 7th Congressional District Representative Congressman Tom Tiffany will be back for his monthly chat with us. Shoot, you know what, Fitz? I should probably contact his press secretary and find out if he's even coming on. I don't know, with the Capitol and everything happening.
Yeah.
I don't know. I should probably find out. So as of right now, he's supposed to be on Thursday. Next Thursday, so a week from this Thursday, we're debuting a new show called Politically Speaking, which will air every third Thursday. We just secured our sponsor, which is Matt Kirkpatrick from Kirkpatrick Law, to be part of this show. So it's officially a go as of this weekend. And for those that have been asking, met with my mother, Diane, after our Bible study on Sunday in Diane's kitchen. No, it's not a cooking show. It will also be returning. And Fitzy, you and I always like to take like one Tuesday off a month. And
Right.
that's when her show, her monthly chat will be on. She's a filler for us, I guess.
Maybe we should start a cooking show.
Oh, that'd be fun, actually. Like, I could teach people how to, make macaroni and cheese with hot dogs, and there is an art to that.
I can microwave a hot dog.
Oh, my goodness. Well, anyway, that's all I had. Fitzy, good morning. How are you? What's going on, man?
Yeah, not much going on. It's busy. We've been really busy around here, and nothing press release related yet. But we were busy. We've had a couple burglaries that we're working on solving, and we're doing a lot of law enforcement stuff. So it's been fun. It's been good. And, I think we're gonna catch some bad guys. So that's
I was
always
going to
good.
say, so when you say fun, I mean, first of all, I'm assuming that means nobody's died, right? Because
Right,
even though we try to stay
right.
positive and, little light on everything, I don't think you
Right.
would even say that, anything with a death is fun.
No.
But catching bad guys, that's fun.
Yeah, catching bad guys and getting stolen property back and doing a lot of good in the world. So I'm feeling good, and our department is stepping up and doing some pretty cool things. And like I said, nothing major, but we're getting stolen stuff back and finding some stuff. But so it's been busy. It was a quiet weekend, nothing real major, but
Was
it was little burglaries here and there.
You say little burglaries? Is this something that you're just? Well, obviously you probably can't get into it now, but was there a connection, or is this all of a sudden it's every once in a while we kind of get these spurts of some burglaries, bored people, maybe it's this time of year, or is it this is kind of an anomaly? We don't usually see this many in this short proximity of time.
No, I think it's crimes of opportunity, and most of our burglaries are opportunity driven. So it's like, oh, this just happened to be right in front of me, so I stole it, and then it snowballs into something else. So luckily for us, our burglars and our bad guys are lazy. That's why we tell people, during Christmas time to, don't put the president right in their front seat, and say, please take me now. And so we're lucky enough that, they're not going to work real hard to break into your car if there's nothing in there that they see. So, I mean, out of sight, out of mind is kind of a thing. And I think an opportunity that someone left something somewhere, and the opportunity was there, and it snowballed into something, a little bit bigger. And I think we've done a pretty good job of curtailing that and bringing them in and finding the bad guys and doing what we're supposed to be doing out there and getting people's stuff back for them.
Well, and it's nice to see these kinds of things. That sounds horrible. But
Right.
I guess juxtaposed to
Right.
seeing, horrible things that are happening. Well, yeah, we had this another fatal crash or
Right.
a death of any
Homicide.
kind, pretty much.
Right.
So, catching bad guys, that's, I don't know, I'm assuming that's part of the reason cops want to be cops. Like before you're a
Well,
cop, it's, man, I want to catch bad guys. I want to make the
right.
community safer.
Hmm.
I don't
Yeah,
know.
and the drug world is picking up, and our meth is back flowing, and so our drug unit's been busy, and no, we can't get people to stop doing that. So we're going to continue to arrest and work on some different programming, and we're going to look at expanding some of our jail programming. So we got a lot of stuff going on in 2021 already, and it's been great. And I've got a great team behind me that's doing a lot of work, and I'm very happy with our outcomes already. What are we, 12 days into it?
Yeah.
What about you? What's going on?
Uh, Not
Oh,
much.
it's that exciting, huh?
No, right? Yeah, I know. I've
We
been
better we
obviously with
better
all
get
the
Mike in here.
yeah, yeah. We're gonna have him out a little sooner than we anticipated. No, I kind of hit a wall with news, which is the first time I've been doing this for over 5 years. I just hit a wall, and it's like I don't even want to watch like 7 o'clock. I always watch the first 20 minutes of the CBS morning show.
Hang on, my phone's ringing. There, I'm good.
You still have the default ringer.
Yeah.
Who does that? It's called Zedge, Zedge. Download it and just put a new ringer on there. My goodness. Yeah, so I hit a wall with news. I just didn't want to watch anything. So I'm just watching some sports. My wife, Drusha, got me the collection of Calvin and Hobbes for my birthday a few weeks ago. So I've been going back and reading some Calvin and Hobbes. I don't know if you've ever read Calvin and Hobbes. It's the funniest script ever. Columbo. Hey, right? You ever watch
Right.
Columbo?
Are you going to learn to be a detective? For our
No.
ride-alongs.
No.
That's called training. You can write that off.
Nice. See? Look at all the stuff I'm learning. Such a positive show already.
That's right.
Yeah, but anyway, there has been some news, and before we get to that, anytime we do a show, any press releases or any stories that I've done, we like to kind of discuss. I didn't have anything. I should have something up today from a Barron County thing, but I did have one that was technically Burnett County. The headline was "Man sentenced on homicide charges from 2019 fatal crash in Burnett County," but the individual is from Cameron in Barron County. I wasn't sure if you were aware of that situation or if you had any insight into that or any comments that you wanted to make.
No,
Perfect.
don't know.
All right, next.
That one I don't know about. I usually try to keep on top of stuff, but I'm trying to stay in my own four corners of the county.
Okay.
Tracy's got Burnett County covered. She's good.
Yeah, I love Tracy. We had her on not long ago, didn't we?
Yeah, we did.
Oh, I like her. So I wrote down just 2 talking points here, just because there's a lot been happening in the world, because there really hasn't been. I mean, it sounds like you've been doing some busting some bad guys down in Barron County.
Trying.
I'm reading Calvin and Hobbes, so pretty much, not a ton of things. But obviously, last Tuesday when you were on, we were talking about the decision that the district attorney was going to have to make to press charges against the officer that was involved in the Jacob Blake shooting. We discussed it a little bit, but obviously we didn't go any further. We wanted to wait to see what he said. So obviously now that we know what's going on, I would really like to hear your thoughts about that decision.
Well, and I haven't had time to really follow that decision, but I mean, I know what the decision was, obviously, to not charge the officer. And again, the district attorney what he has to do is say, did you violate city or county policy? Did you violate the rights of the person? And so that's the kind of stuff that the district attorney looks at. And obviously the officer followed the policies of the department, didn't violate the person's rights, and so and so. So I mean, you kind of saw that writing on the wall that he didn't, based on what we knew. Again, most of our stuff was from the media. In fact, all of it was from the media until the district attorney produced some of that stuff. You had an independent person look at this. You had the DCI look at this. And then the district attorney looks at this. So you have a state agency, an independent agency, and an elected official all look at this separately and came up with that same conclusion. So I think it was done very well in the fact that it was looking, that many people looked at it, and it wasn't just the district attorney taking the word of the police officer. He looks at all the evidence, all the video, all this stuff, and so, he didn't violate it. Whether you like that he fired 7 times or not, we weren't there. You
Yeah.
fire until we're stopped. We don't shoot people in the hand. We don't. I mean, that's the kind of stuff we need to teach people about, because as a trained law enforcement officer right now in the state of Wisconsin, we don't shoot the gun out of your hand.
Yeah.
I mean,
Don't shoot in the leg to slow you down.
right.
Right.
We shoot to stop, and some people don't like that, and that's, then if you don't like the seatbelt law, you have to change it, and that's where some of this criminal justice reform. But it's still going to be shoot to stop, because even if you get shot once or twice, your adrenaline keeps you moving forward, and that's why people escape situations, and that's why people continue to shoot guns after they've been shot. It's not like TV where you just get shot and you fall down and
Yeah.
you die on the scene. And so, you have to look at all of these factors in this case, and I don't know them all, so I'm not going to comment on them all.
Sure.
But that's how decisions are made. Again, I thought it was well done by independent agencies times 3. And so,
Well, I did read through it, actually. I read through the whole thing. The district attorney is basically a synopsis.
okay.
And there were a couple of things throughout this whole process that I was interested to see how it was addressed. Because I think these are the two things that were on a lot of people's lips throughout this entire thing. And that was why, as you had just mentioned, why shot 7 times. And the race component. And I think we've talked before, when it comes to the race, I mean, apparently there's been no history of that in this officer's situation. And I don't know, you could have an opinion that it was racially motivated, but it's just your opinion. I mean, we can all have an opinion, but we can't all have facts, like your own facts. The facts are the facts, and that's just what it is. But looking through this entire synopsis, I didn't see anything in there regarding pretty much anything to do with race, because how do we really know what's in a person's heart, right? I mean, I don't know. You could think that, well, it's another white cop shooting a black person, and that's totally legitimate, right? I get that. But we don't know what was in his heart. I don't know if he's racist. I don't know if he wasn't racist. I have no clue. But I think sometimes it's dangerous when we start looking at, yes, but cops, and they tend to look at the data. They shoot more black. Yeah, sure, but that's kind of a little more macro. I think the district attorney has to look at this specific case. So I found that interesting. And the second one was, and this one really was a question that I had, was the 7 times. And according to this synopsis, the officer had stated to the district attorney, I shot, because I think at the time he was in his vehicle, his back was turned, and he had a knife. And he said, I shot until the knife dropped. And that was it. And I'm not saying that makes it okay, but I don't know. Is 2 shots okay? Is 7 or 10? I don't know what the number is, but I just want to know why the 7. And according to the officer, or at least according to the district attorney, the officer had stated that he shot until the knife fell. Does that fall into that purview, or that what you had mentioned about shoot to stop?
Yeah, we don't shoot you twice and then decide if you're going to shoot back or not. We don't do that. We shoot until you stop moving forward, you retreat, you get to cover yourself. I mean, there's a lot of different things, but you got to look at all the circumstances. There was people in the car.
Yeah, kids in the car, and that was another concern that they had brought up. Or I'm sorry to interrupt you there, but that was another concern that the officer had, that taking the kids, is this a hostage situation now, or holding the kids hostage? Is he going to hurt other people when he is driving now, knowing, because they were trying to arrest him because he had a warrant for his arrest for some pretty significant things, by the way. Yeah, the whole thing. I would strongly encourage anyone and everyone to. You can readily find this on the internet everywhere. The actual synopsis from the DA. I would strongly encourage people to read that.
Right. Yeah, always educating yourself about more things and asking more questions and talking to us. I mean, that's why we have a shoot, don't shoot scenario training, and we've ran both our Citizens Academy and our law enforcement committee, who I give reports to, my law enforcement, which is made up of county board members. We put them through that so they understand what law enforcements do and how quick second decisions have to be made. And so we bring that in every year for our officers. We bring that in for our Citizens Academy and some other people. And so we try to educate people on use of force.
Mm.
And I think where law enforcement needs to do a better job of that is educating people on use of force. Before we use of force, we need to tell everybody in Barron County or Washburn County what use of force really means. Why do we do use of force, and how do we choose to use a gun versus a taser and things like that? And so I think describing use of force before we do it, not after we do it, is what we need to do better as law enforcement officers and law enforcement administrators. So that's why I've tried to do that over the years. You always can't bring 1,000 people in and run them through the simulator, but we have that technology here in Barron County, and WITC has it for our training of our law enforcement officers. So we need to do a better job of that, and that's something we can do so it makes not these cases any easier, but it makes them easier to understand.
Yeah. Well, we're looking down here in our virtual green room, and I can see Mike Schafer falling asleep already. So,
Okay.
No, that's all right. But I want to just get your thoughts on a couple things here, real quick. Is that, of course, the Capitol situation happened.
Right.
In your vast amount of free time that you have you been following that at all? And if so, what are your thoughts? I'm curious.
I haven't. I know, that the Capitol got overtaken. I don't think that is the right thing to do. Obviously, I don't believe in people blocking freeways. I don't believe in people blocking roads or destroying public buildings. There's ways to get your message out there, to do it correctly and the right way. And so I'm not in favor of that. I just think that people need to respect and react appropriately, and you just can't do what you want to do. I mean, that's just not how it works. And so I'm disheartened by that. I know everybody kind of is. It's easy to get in that mob mentality, though. I mean, you get into a mob. That's why kids underage drink. That's why we have that. It's the peer pressures of the world is what law enforcement has to stop.
Yeah.
And it's on us to do that. And maybe we don't want to do that as law enforcement officers, but that's too bad. That's our job as law enforcement officers, to stop that mob mentality, and we need to do a better job of that. And we need to help. We need the respect of some people to help us do that, and that's what it's about. So we'll leave it at that.
Yeah. Well, and we talk about social media a lot, and that words matter.
Mm-hmm.
But when people go after each other on social media, you can see who it is, and you can just you're an idiot, because let's face it, those people exist. But seeing this mob mentality, not on social media, seeing it in real time, like not just real time, but in person, and people died. Right?
Mm-hmm.
I mean, that just blows my mind. That what are we doing here? I mean, it seems like, Fitzy, I don't know. I feel like sometimes we have gotten so far as a country and as a human race and as a society and as a people, and then I turn around and I go, man, we're nowhere. We're just nowhere. I don't know. I don't know. I don't know.
Yeah.
It's very frustrating to see.
Yeah, it will very much so. Very much frustrated, and there's a lot of good in the world, and that's why we started this Positive Tuesdays, because people were tired of watching the news, and people were tired of COVID, and which is still going up and down. We don't know which way COVID's going, but Mike's going to give us all this great news in just a minute.
He's going to give us a lot of positive news. So you're watching Positive Tuesday with Ben and Fitzy, presented by ICAA. ICAA is your local social service organization that works together with individuals, families, and the community to create and support local solutions for local needs. For a full list of services from ICAA, check them out on their Facebook page or visit their website at indianheadcaa.org. So let's get our guest in here today, Spooner Hell's CEO, and for the first time we can actually call him this, or someone this, friend of the show, since he's now been on multiple times, Mike Schafer. Mike, how are you? Good morning.
I'm great, and I'm honored. I feel like a Saturday Night Live host who gets his own lounge after so many appearances.
Yeah. So here's a quick tip: when you say honored, don't do it with a big smile on your face.
I'm sorry.
Honored.
I'm sorry.
Yeah,
I never was much of a poker player, so.
You don't have to pay Mike yet. He hasn't made the gold yet for being on our show.
Yeah,
but maybe
right.
after this one, maybe, yeah.
And this is your fourth time, by the way. I looked this morning. Mike, this is your fourth time you've been on a Dryden Y Live or a something. So your fifth one, then you get a jacket.
I didn't realize I got to count the two from when you were just kind of in your rookie stage until you got professional with Fitzy joining. So
Yeah, nice. So I was talking to Fitzy this last weekend just about the show, or just texted and said, are we doing one this? Because we always like take one Tuesday off, and we never really know which Tuesday we're taking off until like a day or two before. And I said that I had a conversation with you. I just had some questions. I was watching on Sunday morning the Talking Heads, right? Face the Nation, Meet the Press, stuff like that. Whole bunch of health experts and the vaccines and all this. So I called you and I said, so what is going on? And I was lost through, about half of everything that you said, because you're here and I'm down here. I don't really get a lot of it. So I asked Fitzy if maybe we should have him back on. He was just on a couple months ago, but I think a lot of questions are still happening regarding the vaccine, whether it's the rollout or whether it's when President-elect Biden gets in, and he said that he wanted to release all of it. At least that was the time back on Sunday. I don't know what is happening with the vaccine. Fill us in, catch us up. What's going on?
Well, I'll start with what I think is the good news is that you are seeing vaccine flow and getting injected into people's arms. And I think in this part of the state, we're ahead of a lot of places. We were fortunate to be one of 24 hospitals in Wisconsin that originally received vaccine. And the timing of the vaccine gave us more than we expected to get, to be honest, because we were warned that we weren't going to get full doses or full requests typically, because they were going to do some to everybody. But since the state had only, they say they did 24 because they wanted to test the transportation system. And with the Pfizer vaccine, which is what we got, it is very well orchestrated how they deliver it from the hub in Eau Claire. It has to be kept at a certain temperature. Highway Patrol actually delivers it to us, and we have to sign off, check the temperature, both us and Highway Patrol, when it gets here. So I can understand why they went with a few. With fewer number of hospitals to start with. The fact that they weren't prepared is a whole nother story. But so we were fortunate. Another piece of good news that came is the day we got our vaccine, the FDA came out, and in the past they said only use a vial of Pfizer vaccination for 5 vaccines and throw the rest, discard the rest, which made no sense. Everyone's getting 6 doses out of a vial, so that's 16% more vaccine than we expected. So we were able to vaccinate all of our healthcare workers at Spooner Health that desired to have it. We were also able to start opening it up to healthcare workers in the community that weren't affiliated with us. And we initially did 229 vaccinations here at Spooner Health. 127 of those were employees. The rest were other healthcare workers, some who provide some services at the hospital that don't work for us, others that are providers in the community. And last Thursday, we started our booster vaccinations. We're up now, I believe, to where we have about 169 people who've been fully vaccinated. And the rest of those that we did will be, I think tomorrow will be their booster.
Hold on a second. So how does that work? I'm not asking because, I wrote this down. It's a great question. I literally don't know. Like most questions I ask, I just because I don't know the answer to it. So if people were already getting the vaccine, do they have to get the booster after? And if so, in a certain amount of time?
Yes.
Is that how it works? And is the booster the exact same thing as the first vaccine? Or is that a separate vaccine?
No, it's the same vaccine. It's the same dosage. Pfizer, for example, which we have, all the studies show that 21 days is the time that you need to give that booster vaccine.
So you need it twice.
Need it twice. Same thing twice. And the studies show that the efficacy of a Pfizer vaccine after one dose of having it for about 3 weeks, you should be at a 50% efficacy or 50% effectiveness. After having the booster in another week, you should be at 95%.
Oh, wow.
So that's why the booster. The Moderna, which is the other vaccine that is out in the state of Wisconsin now, and for instance, Shell Lake Hospital ended up getting Moderna for theirs. They go 4 weeks before their booster. But again, it's a 2-shot. The AstraZeneca that we're hearing about in Great Britain, I believe, is also 2 shots, but Johnson & Johnson is working on a 1-shot vaccination that they hope to bring forth through FDA emergency use authorization in the near future. So yeah, it's very necessary to get the 2. It's one of my big concerns, and that I think the federal government has done very well to this point is we knew that when we got so many vials of Pfizer vaccine delivered to Spooner, we knew that they already had the vaccine for the boosters at the hub that we would get in 3 weeks. So that sounds like that's going to change. I just heard that this morning, that they think there's enough out there now that they're going to start not holding back so much for second vaccinations. It's a little concerning because it has worked so far. As long as the flow keeps coming, I guess we'll be okay. But
Yeah,
and I would.
I think
Go
that
ahead.
comes from the political pressure to get more vaccines out there, don't you? I mean, yeah, I think it's bad that we need to make sure that second dose is always there, but I think the supply maybe into Madison is coming better, and then we get it from Madison. That's correct, right?
Yeah. Some comes. I think that the Pfizer actually goes directly to the hubs. I might be mistaken, but the people in Madison decide where it's going. They apply. The federal government decides how much we're getting, and then the people in Madison decide where it's going. And as I said, we were fortunate. We've worked. I do want to just give credit. We've worked very close with Washington County Public Health on this. We've worked very close with Indiana Medical Center in Shell Lake. They reached out as they got their vaccination, and they also vaccinated a number of healthcare workers in the community that were unaffiliated with them. Most of the tier 1A, as the federal government in the state defines, healthcare workers that qualified for vaccination in our county have been offered at this point. So,
The mutation of this, as far as you know, like the UK thing, and I guess there's this, South African, I don't know if it's called strain or what, just this different version, like the flu, it always changes. Is this kind of universal, right? Is it the vaccine will work regardless of how it mutates?
Pfizer has come out and said that they feel the testing they've done that it will work on the mutations they've seen. Okay. Especially with the technology, the mRNA technology, it's basically developing that protein, developing that antibody in your body. So they feel that the testing they've done, it's going to work. That's always a concern with any mutation of any virus, obviously.
So I publish every day the COVID-19 updates for our area. Does that mean I fall under the not a part of you, but the health community, and I can get a shot?
No, sorry. You hide in your studio. We can't count you. No.
Right.
Interesting. Today, the state came out, and one of the frustrations we have here is we're ready to keep vaccinating, but we recognize other parts of the state haven't gotten a critical mass of their healthcare workers vaccinated yet. But 1B, which is going to be the next phase, it appears the state's going to include anybody over the age of 70 in 1B, and then some essential workers, and they're defining essential workers. What we're hearing now, it was going to be law enforcement, first responders, teachers, things. Today or yesterday, the state came out and said that they're giving permission basically to start vaccinating those law enforcement and first responders that technically weren't 1A. I think a lot of people could argue that because of what law enforcement and first responders do in the rural area. But that was good to see that. So we'll be back in working with public health and working with people in our community to see if there's ways that we can get more vaccine and start vaccinating more people.
Sure. Yesterday I had published a thing or a press release from Governor Evers stating that he was calling, and Evers and DHS was calling for, I was just looking at, where was it? A release. Governor Evers and DHS call on federal government to distribute more COVID-19 vaccine. Now, that was yesterday afternoon. So has something changed since then? And if not, if you're saying that it seems to be going okay, so why are they calling for more?
Because we need more. People aren't getting full allotments that they request. One of our big concerns coming forward with moving forward as we get into 1B, working with the county, working with county, we work with Indiana Medical Center, North Lakes and Minong, and Essentia Spooner. We're meeting regularly to talk about how we're going to handle vaccinations and how we could do mass vaccination clinics. Our concern is we're not going to have to start doing mass vaccination clinics because we're going to get a trickle of vaccine. That's our biggest concern and how do we decide who's going to get vaccine when you have so many people who qualify for the vaccine. Right. So what the governor's wanting, and I find it kind of ironic because a couple of weeks ago we had some sitting on the shelf that wasn't getting out to people to vaccinate in the state, but they're saying send more. And we'd love to see more as long as the state can get it out, because we're going to have a huge demand as we move forward.
Yeah. Well, Dave Wilson has commented, starting next week, state okay given. Yeah, I don't know what that means, Dave.
Yeah.
Do you guys know what that means?
It's just what I was talking about for law enforcement and for fire department.
Oh, sure.
He wants to be included in the show, obviously.
Yeah, that sounds about
He
right.
just types something every week, and we just like, yeah, Dave, good job.
So a lot of people are wondering, though, so when I saw Barron County had put something out last week, and we published it as well. It was like this rollout plan. And I'm assuming that's going to be an evolving thing. It's just kind of a guideline where we are right now, and maybe every week or every month or when needs be, it will be updated. As far as you know, really, what are we looking at in terms of when can I get it? When can Brandon Armstrong, who had commented, and Jody Gray, and maybe they're in 1A, 1B, I don't know if they are or not, but when the average person, when do we get it?
I would say months, based on what we're hearing. No, the state has a group called the SDMAC. I'm not exactly sure what the acronym is for, but they look at CDC guidelines as to how they're recommending distribution of vaccine to who. And then states have been given permission by the federal government to put their own priorities in place. And I talk about stage 1A. Stage 1A was healthcare workers. Stage 1B is still not totally defined, but what I think the state is later this week going to have out their Plan 1B out there for comment, but it's going to be people over the age 70. And we know that's the group that this is deadly for, and it's going to be certain essential workers. I was just told last week that the hope is by the end of the month, we're working into stage 1B. Well, I was in preparation for this. We looked at the numbers, and I don't have them right in front of me, but we looked at the numbers for how many people over age 65 do we have in our county, and there's a few thousand. So if you get 70% of those people wanting a vaccination, it's going to take quite a while to get enough vaccination and to vaccinate all those. So then the belief is 1C is going to include other seniors and then anyone with chronic conditions. So they're working through those that are the most either the highest exposure or those that have the highest risk, like the elderly, like essential workers, like those with pre-existing conditions that do worse with COVID. So by the time we get enough and roll it out to general public, I think from what I'm hearing, we're looking at least months.
No, and it's gonna.
I'm sorry.
It's gonna be if we're vaccinating half of, it's about 50 to 60% people that want the vaccination. Is that what you're hearing, Mike, about that?
What?
And so,
yep.
Yeah.
That's it?
That's about it. Yep. So, but if you look at that, that's 22,000 doses in Barron County or ish, the 50%. Yeah. And if we're only getting 100 or 200 doses every week, it's going to take a lot of weeks to get to 22,000 people.
Especially if you have to do the second one, right? So is that 100, in that hypothetical there, Fitzy, if you get that 100, does that 100 also, is that for only first doses, or is that for the booster?
You get your second dose. So I only counted as first doses because the second one automatically comes 3 weeks later. But it takes a lot of 100 doses to get to 22,000 or to get to 10,000 in Washburn County. So they're going to have to get faster because our healthcare system can accommodate more shots. Correct, Mike? I mean, we can
we can at this point, but it's really going to take a group effort. I don't believe we're going to be able to vaccinate people like we do flu shots through your normal appointments at clinics and that, because the demand is there. Clinics are getting called. When can I get my vaccine? Public health departments are getting called. When can I get my vaccine? We've talked about, how could we set up mass vaccination? Is there a place we could do it if we get the vaccine? And that's the key. To give you an idea, we did our first vaccination of 170 people. We did it over 3 days. We did it in our classroom downstairs. We scheduled up to 4 people every 15 minutes because we have to watch people for 15 minutes. One of the big limiting factors we run into is having the space to socially distance, to do this in a way we're socially distanced, and to keep the people who've received the vaccine while they're being monitored for 15 minutes socially distanced from each other as well. That alone doesn't give us many places in a small county like Washburn County that we can do mass vaccination clinics. And here at the hospital, I think, we could do more in a day than we did if we had the vaccine,
Mm.
but we're probably able to do 80 a day, just to give you an idea, to safely do it with social distancing, with everything else.
Sure.
That also involves pulling people away from their normal jobs. Now, we realize that's part of our mission to the community, and we are going to do everything we can to vaccinate people, to work with public health on any vaccination clinics we have. As I said, I think we have unprecedented cooperation in our county, and I think you see it nationwide of health systems that typically don't. I mean, we really haven't done a lot with Indian Head Medical Center over the years, but we talk all the time about this now. It's really kind of we're looking for the common good. So that's the concern is and if we get mass vaccination, how do we safely give that vaccine as well?
Yeah. So you are obviously way more up to date. So thank you so much for coming on, because on Sunday, a lot of the talking heads and the health experts had stated that President-elect Biden, when he gets sworn in, had called for the release of all those 40 million that are just sitting on a shelf somewhere. That we just got to get these all out right now. I'm assuming that it's because everything's happening. It's so fluid right now. Is that still, from what you've heard? Again, I'm not saying this from a political standpoint. I just mean, if there are things that are around, why not just send everything to everyone right now?
Well, I think that's. I got to be careful how I say this. I think Fitzy said, we talked about this a little earlier. He mentioned political. Part of what Biden is saying is definitely political, because there's reasons that's sitting on the shelf. Some states were very ill prepared for this, and that's one of the reasons sitting on the shelf. State of Wisconsin, for example, we now have 1,000 people who've been approved to be vaccinators. Well, a few weeks ago, that was in the 10s or the 20s. It was very low. Our state was very slow in getting people approved and hiring people needed to run this program. So part of the problem in this has been at the state level in getting it out. Now, my understanding is most states are catching up at this point. Also on the shelves are, and I'm not sure if they're included in the number that they keep saying, is that second vaccination. And I'm very concerned. And now, as of today, the federal government this morning, and I think it was a Surgeon General I saw on TV this morning, said they are going to start releasing more because they feel that the flow of new vaccinations will keep up. But my biggest worry is how is the state going to handle? I mean, it puts more pressure on the state for distribution now when they're having to juggle sending out new vaccinations, sending out the second dose to make sure there's enough for the second dose. Where right now that was pretty simple. Ours was held back, and the Moderna was held back by the company as well. So my concern, all the studies show that you need that the booster at 21 days for Pfizer, 28 days for Moderna. What happens if we get into weeks later that we're not getting our vaccine? So what we did is we scheduled people exactly 3 weeks later to have their second vaccination, so they knew when they were going to get it. And what happens if you don't have it? Yeah. You go through the nightmare of rescheduling. What if it's a month? What does that do to the efficacy?
Right.
Nobody knows, because it wasn't studied. Yeah. So
can you guys borrow it back and forth to each other, like Barron County? Okay.
No, that's the other rule. That's a big rule.
Yeah, I mean, we were early on. We were scraping with that first to get people. We actually vaccinated a few people from Essentia Clinic next door because they hadn't had theirs yet. They in turn vaccinated a few of ours that weren't able to get it for whatever reason. But we were scraping because we did not want to waste a single dose. Someone called it liquid gold, and it really is. So, and we had to get groups of 6 because we wanted, so if we had 33 scheduled one day, well, we had to get up to 36.
So, here's the question. Who's paying for this again?
Federal. Well, you and I, the taxpayer, because the federal government.
I love how you peeled it back for me. But I mean, just you don't start with this, and then, but who's paying for? Okay, then who's paying? Yes, no, us.
Yeah, there is no cost for the vaccine to the provider that's doing it like us. There's no cost for the vaccine to anybody. The federal government's paying that, but people can charge an administrative fee for giving the vaccine. And I'll tell you, I just look at the amount of time we have put into vaccination so far of our people and other affiliated healthcare workers. We have not charged an administrative fee yet, but we will begin to, because there's a lot of time and effort and money gone into it. We were just happy to be able to roll it out to start with.
Always give the first ones away for free, right? Isn't
Yeah.
that a crack cocaine thing, Fitzy? Right? Isn't that what they say? Drugs. You always give the first one for free, then you start charging them
Wow.
because now you got them hooked. The first one's free, but that booster that's going to cost you 10 grand.
And that's not
Oh.
what we're doing here.
Oh, it's not okay. All right.
Where'd you find this guy, Fitzy?
Yeah, exactly. I said we should always start our own show, but we have the process of a drive-through clinic where we have the plans in place for one if we can get enough shots. But again, our shots are coming in like Mike's in Barron County at 100 here and 100 here. Well, we can handle that. If we were to get and it's a storage capacity, it has to be kept and has to be given out as soon as Mike gets it or Barron County gets it. They have so many hours to give that out. I mean, I think it's days, but I mean, it's all down to hours here, and because of storage capabilities. So you can't say, I'll be in at 2:30 on Tuesday to get that shot. It has to be now or never. So I mean, there's some time limits on this from a healthcare or a giving out it, but it's also tough to start a drive-through clinic in Wisconsin in the middle of the winter. So it's tough outside. It's cold. So we're working on indoor facilities and things like that.
That's an excellent point about having to do this within a certain time frame. The Pfizer, for example, it has to be stored. It can be frozen at regular temperatures for, I believe it's 5 days. I'm a little out of my lane here when I talk specifics. My pharmacist, Tim, is great at handling this stuff, but I think we have 5 days in which to use it. Once it is taken out of the freezer, you have a matter of hours to give that. And it's like we tell people, we had a couple people, it's not convenient to come in on Thursday, well, too bad, because we're figuring this out in groups of 6. We have to do it within a certain time frame. We can't tell someone, well, you work at 7 at night. We'll have someone here to give it to you because you have to use it within a certain amount of time. So that's one thing that is real interesting about it. It's not like a flu shot where, we can vaccinate our flu shot people in the middle of the night if we really want to, It's different.
Yeah.
I'd love to talk with you, Fitzy, offline, maybe a little about your drive-through if you're willing to do that.
Yeah, no, definitely. We're just working on that plan last night or yesterday afternoon on that. And we think we got it figured out. But again, you got to have a place and a drive-through, and it's got to be heated, and it's got to be because there's storage things even when we take it out. So, yeah, I think we have a pretty good plan for that. And again, yes, like you said, Mike, we're working with our public health here in Barron County like you do up there in Washburn County. And our hospitals, again, our essential workers, again, are
doing phenomenal.
1B has done a good job. 1B is going to involve a lot of people. And again, I don't know that the doses are going to be there for 1B, but maybe we're going to get semi-loads of this and we'll be able to hammer it out.
Yeah. Based on Mike's laughter.
You can't send it our way. That's right.
Right. It's Positive Tuesday. We got to think of something.
Yeah, that's right. And by the way, I did want to say, Mike, I'm so appreciative of your photo that you had today for the show and an announcement. You were wearing your Chicago Bears pin. I saw right on there. Your favorite team. That was very nice of you.
I guess you didn't understand. I graduated from Concordia College in Moorhead, Minnesota, and we have a very similar logo that was in place before the Bears put theirs in. So it was honoring my undergrad Concordia Cobbers, nothing to do with your Chicago Bears. So.
Whatever. Hey, there's a question. I didn't even think about that. From Mark, could it be made in a pill?
Probably not, or they would have.
Mike? That's true.
No, I don't know. I did read that, and I could be wrong here, that somebody told me, and I don't know who it was, they were working on a chewable or something. But, I mean, look at polio vaccine. Yeah, polio vaccine, when it first came, wasn't it drops they put on the tongue or whatever, I think?
I wasn't around then. I don't know.
I'm just happy they have something at this point. I'm old, not quite that old then.
Yeah. Dude, so real quick, right now, where we stand right now today, and I know this is an ever-evolving situation, for Wisconsin only, I don't care about anyone else. Oh, that's horrible. I mean, I do, but for this scenario, this question, just for Wisconsin, and maybe more specifically Northwest Wisconsin, our area, are you satisfied with where we are and where it seems to be that we're going in terms of getting this vaccine to who need it and the community, and we're doing it the right way Sometimes it may take a little longer, a little slower process, but kind of like government, maybe that's a good thing so we don't knee-jerk reaction on things. Are we in a good place right now, and do you see this continuing?
I don't know if satisfied is the right word. I'm happy with what we've accomplished so far in such a short time. That we've gotten so much done in Washburn County with all the groups working together. I guess I mean, our pharmacist sent an email to our staff, about we need you on this day. And he made the comment, he said, 2 months ago, he says, we would have walked 5 miles to get this vaccine. We're way ahead of where we thought we might be. But I don't think we can be satisfied. I really think we need to push it. I mean, we want to get back to normal. I mean, businesses are still really struggling. There's so many things that we need to do that I'm not satisfied. And I am concerned. I'm concerned for as we get to the phases. I mean, 1A. I think they figured about 500 to 550,000 doses needed for healthcare workers, nursing home residents, and that.
Mm-hmm.
Well, 1B. Now you're talking everyone over 70. I haven't seen a number, but it's going to be greater than that. And as we move forward, so I don't think we can ever be satisfied. I think we need to keep pushing and try to move forward. But the fact that we're vaccinating people, that's very positive.
Yeah. One more thing here. I'm sorry, Carly had a great question. I wish people would put these questions a lot sooner. These are all great questions, but we're way past our time here. But I want to ask this: will this vaccine be needed in 10 years? Is this like the flu thing, or is this something that is just gonna just get used to it? I mean, in the fall, you get your flu shot and your COVID shot.
I don't think anybody knows. I heard today that Pfizer says protection should be good for a year. Is this one of those that's going to be like MERS back 15, 17 years ago that flamed itself out? Once we get herd immunity, will it flame itself out? Will it mutate? I don't think anybody really knows. The other question is, how long is the vaccine good for? And Pfizer did say this morning they think theirs is good for at least a year, and they'll keep studying that because they don't know. They haven't had the time frame so far. So tough question to answer. I'm sorry.
Yeah. And Ben, we haven't done our drive-through yet. And to Shasta's question about hours, we are thinking about having our drive-through with some early evening hours. So that was discussed. So yes, we have those in place, like a 11 to 1 and a 4 to 6 or something like that. So on our drive-through, and that hasn't been set because you do have to monitor people for 15 minutes to make sure they have no reaction. Although we've had some people here fall under 1A and they've gotten the shot and the first shot and no reaction at all. So to eliminate, I have my first shot. Mike's had your first and second, I think, Mike, or first shot for sure. No reaction. We didn't turn green or anything like that. So I mean, I think there's some fear out there, a legitimate fear that this is going to turn you green or, something like that. We've had a few people vaccinated at the sheriff's department. We'll be all vaccinated, or the people that want to be vaccinated, like Mike said, it looks like next week or the week after. So there is some things moving forward, and right now we haven't seen any reactions from talking to our COVID committee about that. So
good.
We're good. Those are positive things that we want to keep out there because the more people get vaccinated, the quicker we go back to normal.
That'd be nice.
Yeah, and we don't refer to them as reactions. We call them immune responses because it's showing it's working.
Good Lord.
And that's what the government calls it. It's working.
Okay.
We've seen a number of people that have gotten low-grade temperatures, fatigue from it, lasted less than 24 hours. But that's the sign that your body's fighting off the vaccine and that things are working. Can I cover one more thing? I know we're running short on time. We've talked a lot about the positive vaccinations. We are seeing numbers in our state ever since Christmas. We're seeing our COVID cases rise again.
Yep.
Hospitalizations were on a nice trend downward. They've kind of stabilized now. I just want to remind people, we've talked vaccination, we've talked the future, we've talked where we're going. We still need to socially distance. We still need to wear masks. We did a great job of back around Thanksgiving of really starting to see our numbers drop. We just need to continue with that because there is hope at the end. And if we can keep things under control now, we're a lot closer to getting through this thing. So just a reminder that things haven't changed as far as social distance, masking. And
at least for our area, in a weird way, right now isn't the worst time to be going through this in terms of like January, right? Where people kind of don't really want to go out and hang out with other people anyways. So, I mean, I don't know. Maybe it'd be better if it was right now it was in June, but right now, I don't know. Maybe this is okay. I mean, it's not that big a deal. Stay home and watch Columbo and read Calvin and Hobbes, Fitzy.
And
He's not paying
another
attention.
thing,
He never does. He never listens to me. Even
He's just distracted, it looks like.
yeah, he's very serious right now. He's got work to do. All right, Fitzy, any last words?
No, I'm getting texts and emails. Sorry, I had to.
Oh, sorry. You had to do work?
I got a job to do. Yeah, I got to do work.
Mike, anything else that you want to add?
No, I appreciate having you having me on to talk about this.
Thank
because I see a couple people have made some nice comments. Once I figured out how to read the comments, I kept wondering how you guys kept seeing them. So technologically challenged, but
well, I think Fitzy just has another computer that he's looking at.
Yeah,
I get him off to the side already.
yeah.
But I know Ben, you've talked. You've talked about having one of our other our pharmacists on to talk about.
Can't wait.
Yeah, and he will address more of the safety of the vaccine and the things. Fitzy said it right. It's safe. It was developed fast, but it's good technology. I see Chuck Nelson made a comment about it went fast, but when you work on it 24/7 on a vaccine like this, the federal government did a great job. Not federal government, actually, the companies that did a great job with it. I just encourage people, as you get your opportunity, please take advantage of it and get vaccinated.
Awesome. All right. Thank you, gentlemen, so very much. And thank you to our guest, of course, today, Spooner Health CEO Mike Schafer, for jumping on for a chat with us. For Barron County Sheriff Chris Fitzgerald, I'm Ben Dryden, and you've been watching Positive Tuesday with Ben and Fitzy, presented by ICAA. ICAA is your local social service organization that works together with individuals, families, and the community to create and support local solutions for local needs. For a full list of services from ICAA, check them out on their Facebook page or visit their website at indianheadcaa.org. I'll see you right back here in 2 days on Thursday for my monthly chat with Congressman Tom Tiffany, and we'll see you most likely back here next Tuesday for another Ben and Fitzy show. So until then, stay safe, keep your social distance, and as always, have a blessed day. Thank you, gentlemen. We'll see you then.
Thank you.